We begin with news about the highly contagious new variants of COVID-19. They continue to spread as some provinces begin easing restrictions. Canada's top doctor said today the number of confirmed cases of the new variants in Canada has more than doubled in the last week. 381 cases have now been detected in 8 provinces. Since genomic sequencing is needed to confirm the variants, it's likely more cases exist. And in 3 provinces, there is now evidence the variants aren't just related to travel, but are spreading through the community. That could quickly lead to a resurgence in cases. The federal government is putting tighter controls on people crossing the border. Starting next Monday, February 15th, non-essential travelers coming into Canada by land will be required to show a negative COVID-19 test done within the last 72 hours. Canadians who try to return without a test cannot legally be stopped from entering, but they could face fines of up to $3,000. Changes are also being made to Canada's rollout of the Pfizer-BioNTech vaccine. Health Canada has approved a request to extract 6 doses out of each vial instead of 5. That means fewer vials could be shipped in the weeks ahead. Abigail Bimman has tonight's top story on the change and why at least one province isn't happy about it.
Next week marks the start of a major ramp-up in vaccine shipments.
The Pfizer-BioNTech vaccine will now go further. Health Canada approved a label change to show 6 doses per vial instead of 5.
We expect to receive and distribute approximately 400,000 doses next week and 475 doses in the last week of February.
Special low dead space syringes are needed. The government ordered 64 million, and the first ones are now being shipped to provinces.
The company has come in and has demonstrated through their studies is that if you're using those syringes reliably, using the good techniques in terms of drawing up the dose and administering them, that you should be able to get that 6th dose reliably.
Alberta disagrees.
It is frustrating. I think we made it clear to the federal government and to Health Canada that everybody gets the best training, everybody is using the right syringe. We're only going to get that 6th dose 75% of the time max.
Other provinces are pleased.
We get a bit more vaccine than we expected, but it helps make up for the vaccine reductions that we've had in the last few weeks.
We are working to get the exact perfect needle.
As part of the deal, the company must provide educational support to provinces and send Health Canada any complaints quarterly. And the steady call for more vaccines comes against the backdrop of new variant cases.
Any of the cases that might be associated with individuals having received a vaccine dose, I think would be something else we'd be looking at.
If the vaccines have impact on herd immunity, it may mean that more proportion of the population have to be vaccinated in order for that to be achieved.
Canada's top doctor says provinces must be extremely cautious about reopening. Dr. Tam is worried if cases spike again due to variants, it would be much more difficult to control. Meanwhile, we still don't know how many Moderna doses we're getting in the next shipment 2 weeks from now. We just know it will be less than originally expected. Abigail Bimman, Global News, Ottawa.